So, management of Alzheimer's and medications. There are 5 drugs that have FDA approval. Probably the most common one is called Donepezil or Aricept. So these are the acetylcholinesterase inhibitors. So they try to raise the acetylcholine levels in the brain to help with functions. Memantine or Namenda, and that's for moderate to severe Alzheimer's disease. Regulates glutamate in the brain, so that's an amino acid, to help with information processing, storage, and retrieval. Some antioxidants, such as vitamin E, antidepressants, and don't forget, many people also still have other chronic diseases. So they could have diabetes, they could have hypertension, they could have, hypercholesterolemia. So they may be on other medications besides those for Alzheimer's. Exercise training can definitely help persons with Alzheimer's. There are a lot of studies, but they're mostly cross-sectional on looking at the benefits of exercise on cognitive function. As we talked about other diseases, other chronic diseases, it can improve their fitness, it can improve their mood. Potential slower decline in function, there really aren't a lot of data about that. Could also help with reduced risk of depression, as we know. And exercise can also help reduce undesirable behaviors. As you know, people with Alzheimer's, they can try to wander away, they can get aggressive, they can swear, repetitive behaviors such as tugging at their clothing. Exercise testing. So the important thing to consider is, does the person have enough cognitive function to be able to understand what they're doing during the exercise test? And if they're, highly agitated or if they're highly aggressive, you're probably not going to be able to test people. People in early stages are probably going to do much better. They probably cannot do any sort of lengthy exercise testing. So if you really wanted to do a full assessment, you might have to do it over multiple days versus trying to do anthropometric and aerobic and muscular strength, endurance, and flexibility all in one day. Testing in the morning is usually easier, and there's a phenomenon called sundowning, and that their behavior and their symptoms and their fatigue tends to get worse later in the day. And students who did their internship in these type of settings, they can definitely verify this. Obviously, stop any exercise testing if the client becomes agitated or confused. If you're in a situation where you need to get an informed consent form, is the person able to really provide consent to do the exercise test? They may have to have someone sign for them. And as we mentioned, you may need to also consider what other chronic diseases they might have as well. How do we test them? The cycloergometer is probably easier for a lot of folks. Some people, if they're in the early stages, may be able to do the treadmill, but very slow increments. You may need to monitor heart rate, blood pressure, and perceived exertion. Note their total exercise time. And, instead of doing a 1 RM, you would probably want to do the amount of weight that they could do for 10 repetitions. The modified sit and reach, like from the senior fitness test, and maybe the shoulder flexibility test. And then people who really are moderate to advanced Alzheimer's, they're probably not going to be able to be tested. They're just not going to have enough cognitive function for them to be able to do any type of testing or to really understand the procedures.